So in this video, I will be demonstrating the administering oxygen therapy. Here we have the nasal cannula, the simple face mask or the non-breathable, partial non-breathable mask, the gloves to avoid the transferring the microorganism to the patients, and then the pulse oximeter to check the patient's auto saturation. Now for the assessment. Here we have first assessment is to determine the client history and acute and chronic disease or health problems. The two is to assess the client's baseline respiratory signs, like including the airway, respiratory patterns, rate, depth, and then the rhythm. Nothing indication signs of increased work if breathing. The third, check the extremities and the mucous membrane closely to the colon. And the fourth, for the records management, is the review arterial blood or the arterial blood gas or the AVG, and also the pulse oximetry results for the auto saturation. And then note the lung sound for the wheezes and crackles. And the nursing care, assess the nostrils, back of the earlobes, check the tracheostomy site, mouth of areas where oxygen device is constant contact with the skin. But for this video, I will be using the nasal cannula, so I will be just checking the nostrils and the back of the earlobes. So for the planning, verify the physician's order for the oxygen therapy. What is the order of the physicians to the patient? Second is to check the patient's room. Whenever the possible, replace electrical devices with non-electrical, and post no smoking signs in the patient's room. So for the oxygen management is that prepare the materials needed for the procedure. General materials and equipment. Here is the oxygen source, the flow meter and adapter, oxygen tubing, and then the humidifier with distilled water, according to the agency protocol, according to the hospital protocol. Now I'll be using the nasal cannula and the hypoallergenic tape if needed. And then for the implementation. So for the implementation, assuming that I already washed my hands, I do already the proper hand washing, I will be doing the hand gloving. Assuming that I've already done proper hand washing and the gloving. So I will be explaining the procedure to the patient. Hi Miss Pam, I'm Brian Agdano, your nurse for today. And now I will be explaining the procedure of the administering oxygen therapy using the nasal cannula. If it is okay to you.
Yes, it's okay.
So in this procedure, I will be check your auto saturation using the pulse oximeter, and then I will be administering the nasal cannula through your nostrils. If it's okay to you, Mom.
Yes, okay.
And now attach the flow meter to the wall or tank. The flow meter should be in off position. So next one is the attach on the humidifier of the base of the flow meter. Fill the humidifier with the bottle of distilled water and then attach the prescribed oxygen device to the oxygen tubing and attach them into the oxygen source through the humidifier. Now, for the nasal cannula is 2 to 6 liter per minute, but when the physician's orders is more than or low or in the average of it, the physician's order must be followed. And then check the oxygen if free flowing through the tubing. There should be no kinks, and the connection should be outright. So here is the nasal cannula. Assuming that is already connected to the air flow meter or the gauge with the humidifier connected. Here. Assuming there is a flow meter attached to this wall. And then to check if there is no kinks or the airflow is right, you need to check the oxygen if the flowing is freely through the tubing, and there should be no kinks, and the connections should be airtight. Then fill the oxygen in the outlet, and then outlets of the prescribed oxygen device, and then also check if the humidifier is or has the bubbles that the oxygen gas flows as the oxygen flows through, and then apply appropriate oxygen delivery device to the patient. Now, nasal cannula. In this video, I'll be using the nasal cannula. Place the nasal cannula prong into the patient's nostrils, and then secure the nasal cannula in place by adjusting the tubing around the client's ears and using the slip ring to stabilize it under the client's chin. If the cannula will not stay in place, tape the side of the face using the Eucoplast or any tape that can be placed or can hold the tubing in the patient's face. So in applying patient, assuming that it is already attached in the airflow in the gauge, now the nasal cannula is already secured to the patient's face and to the nostrils. After securing the nasal cannula to the nostrils of the patient, dispose all waste materials properly, and then assess the patient's vital signs, level of anxiety, color of the case of respiration, and provide support while the patient adjusts to the device, and attach the pulse oximeter to monitor the auto saturation of the patient. To monitor the auto saturation level of the patient, which is the air of the patient, air in the body of the patient. And then assess the patients regularly for clinical signs of hypoxia, tachycardia, confusion, dyspnea, restlessness, and cyanosis. And also monitors the patient's oxygen saturation, including his or her ABG 20 minutes after initiating the therapy as ordered by the physician. So that's all for the demonstrating the administering oxygen therapy. Thank you.